Nice to meet you, and thank you for coming in today. So
Hi.
today's sort of session is going to be about consultation to sort of see what you like, how we can sort of support you, setting up a gym-based program, to sort of making sure there's no barriers or anything like that, or risks that could be opposed to you. We're going to do a little health assessment and just run through some general questions about you and about how we can build it to it's individualised to you.
Yeah.
So can we just first go on to lifestyle wise, so job, family, hobbies, things like that.
So I work in residential childcare.
Yeah.
I do shifts.
Yeah, I can imagine it's quite a demanding job.
Yeah.
Yeah.
It's like physically and mentally demanding.
Okay.
I think I have quite an active lifestyle. I don't have any children.
Okay.
I have a partner and 2 dogs.
Yeah. And how old did you say you were again? 29. 29, yeah. That's it. Brilliant. And sort of hobbies-wise, just what sort of things do you like doing?
So I like dog walking, socialising, walking in general, going out for food and tennis.
Okay, yeah, brilliant. And so what sort of things were you looking for from your gym-based program? So what do you want to achieve, your goals and things like that?
So I want to improve my upper body strength.
Okay.
And just have some more structure and help with it, and just be able to learn new things. I've got a 10k coming up in March. So
Oh, brilliant! That's a great goal to have.
Yeah.
Something to look forward to.
So I need to be more fitter for that.
Yeah.
And I've also got a tennis competition.
Okay, brilliant. That's a few things that you've got goals to set.
With my partner.
So that's really good then. So we've got someone to help motivate you as well, keep you active and a bit like that. So that's brilliant. So we can work with those and try and incorporate those into your program. So what are your current activities? So I say you obviously do dog walking. How regularly do you do that?
Every day.
Every
day that I'm off.
Yeah. And how long do you sort of go for?
30 minutes to an hour every day.
Yeah, so probably about 2-3 miles. Yeah, would you say? Brilliant. And sort of how much time do you think that you currently have sort of spare in the week to do these things? Would you suggest, say, on shift day, on the days that you aren't at work, would you have sort of time, maybe an hour on the days that you're not?
No.
Okay, so how do you think?
So only on the days off.
Yeah, only on your days off. Okay, brilliant. And obviously we know what sort of exercise you're currently doing, so just mainly dog walkings and things like that. That's great. So your past exercise, so let's talk about what did you used to do. So have you used the gym before and things like that?
Yeah, so just minimal knowledge in the gym.
Okay, yeah.
But I did used to run like 5k 3 times a week.
Oh, brilliant. Okay, so what made you stop running, really?
Just time, lack of motivation, the dogs.
Yeah.
Just stuff like that, bored.
Yeah, okay then, that's great. So that gives us more to work on as well and sort of get you motivated and things like that. What are your likes? What are the things that you really enjoy
Well, obviously
doing?
I like walking.
Yeah.
I did like weights. Tennis, running, swimming.
Okay, and is there anything you really dislike?
I don't like football and I don't like golf.
Okay, so there's nothing sort of in the gym wise that you would be totally against?
No, I'm up for trying anything.
Okay, that's brilliant. That's a great, positive thing to do. I've heard that. So I'm going to go through with you now a thing called a PARQ, which is basically it sort of goes through and understands whether you've got any health concerns or anything like that I would need to sort of get any other medical referrals with that. So I'm just going to get that and go through that with you. So basically this form is to sort of assess whether you are, what sort of level and everything like that, so we know that there's no health risks that we need to be looking for and things like that, so this helps me. So it's been designed basically to identify those people who may struggle with activity, may have risks and things like that. So right, so the questions obviously are, has your doctor ever said that you have heart conditions and that you should only do physical activity recommended by a doctor?
No.
No? Okay. Do you feel pain in your chest when you do physical activity?
No.
In the past, have you had chest pain when you were not doing physical activity? Okay. Do you lose your balance because of dizziness, or do you ever lose consciousness? No. Brilliant. Do you have bone or joint problems?
No.
Okay, so no back, knees, hips, anything that can be made worse by physical activity?
No.
Okay, that's great. Is your doctor currently prescribing you any medication for your blood or heart conditions or anything like that? No. Okay. And do you have any other reasons why you shouldn't participate in physical activity that you think we should know about?
Nope.
No? Okay, brilliant. So obviously no to all of those means that you are suitable for a gym brace program, and we'll design it around your needs and your goals. So that's great. And you are obviously, it's your own risk, obviously joining the gym and everything like that, but obviously it'll be monitored by us, and we'll be making sure, we'll be reviewing you, making sure that everything's okay, and that we just need to inform you that if there is any changes in your health or anything like that, just make sure you let us know. So obviously we can then adapt it, don't worry, we can try and sort of adapt it, get any medical professional help if we needed to, and we can go from there. So anything like temporary illnesses, or you're not feeling yourself or anything like that, then just let us know.
Yeah.
And then, so that's that form, so if you could just sign there, that would be great.
Thank you.
Brilliant, that's great, thank you. So the next part of this is we will go over the informed consent. So basically this goes over and discusses what sort of we are doing and things like that. So the informed consent says so that you'll understand the purpose of the exercise program, and it will provide a safe, individualised exercise to help improve health and fitness. So it may include cardiovascular activities, so that could be treadmills, walking, jogging, running, things like that, stair climbing and other activities in and outdoors. So we could incorporate things to help, we could add in your program stuff that isn't necessarily inside the gym and things like that. So we've obviously got resistance training, so this would be using resistance machines to help your muscular fitness and things like that. Core flexibility and mobility exercises. This will help improve your core, your stability, and sort of your general mobility, which will really help with that.
Yeah.
So obviously there is some potential risks. So the exercise program will be designed to place a gradual increase in workload on your cardiovascular and muscular systems, and therefore it will improve their function. So obviously there are risks, and there may be certain changes that might occur during the exercises. So just obviously be mindful of these things. But it has been proven and shown that exercise will have some benefits in decreasing heart disease, decreasing body fat, improved blood pressure, improvement in psychological function, and improved aerobic fitness. So the gym program will be explained to you by myself, and any questions and things like that we will go through and make sure that you're satisfied in ensuring you know what you're doing, and we will go through it, and I will show you all the exercises and things like that before we even get down to any of it. So and all of your information will be kept confidentiality, and it will be stored safely and securely following the Data Protection Act. So but we just need to obviously again remind you that anything changes, then just please let us know, and then we can update that on our systems and things like that. So so that's that part first of all.
Cool.
So once I've shown you your exercise program and we've gone through it, we'll get you to sign the informed consent form. Yeah?
Yeah.
Brilliant, that's
Sounds
great.
good.
So we're just going to go back to sort of what do you think could potentially be your barriers to exercising? So what would you say? So is there anything that in your life that can stop you from this?
It's literally just probably lack of motivation from working.
Yeah. So time.
Yeah.
Yeah.
My pets, family commitments.
Yeah.
But obviously, I don't want them to get in the way.
No, of course, and obviously I'd like to work really closely with you, so I'd like, I want you to be able to feel comfortable in telling me and helping me sort of plan it around your lifestyle. So if you're finding it there's too much, or there's not enough, or you think you can fit an extra day in here and there, that would be great, and we can do those things
That's
for
good.
you. So how do you feel in coming back to the gym? feel ready or?
Ready but apprehensive.
Okay, yeah, and that's
Yeah.
great. So that's, that's understandable, and people do feel like that. And, obviously you've been in the gym environment before, it's getting back into that and understanding that, and that's great. So now we're going to do some of your health assessments. So I'm going to do your height and your weight and check your heart rate, which will then give me a total, so I'll be able to work out your BMI. And then also, then we're going to do the sort of exercise sort of assessment. So we'll go through those, and I'll show you what to do with those in just a moment. So bear with me, and I'll just set up with all the height and weight things.
Okay,
in 1 second.
thanks.
Okay, so I'm just going to do your height. So that makes you 5'8". Yeah, and so the next thing, I'll just write that down on my form for you. Okay, and then I'm just going to do your weight. So you just hop onto the scales. Sorry. Okay. Yeah, that's great. So that's 10 stone 8. That's brilliant. Thank you. Okay, and then if you just like to take a seat, and then I'm just going to do your heart rate. So I'm just going to move that back. So we're just going to do your resting heart rate. So I'm just going to sit in it on this. Okay. Always feels like a long way.
Your hands are so cold.
Sorry, I do apologise. Okay, that's good. So we've got a heart rate, resting heart rate of 69. So that's a great sort of score. And did you remember to do your blood pressure? Yes. Okay. So did you pop it on your sheet earlier?
Yeah, it's
Okay.
128/80.
Brilliant. That's great. Then thank you. So I will calculate your BMI, and we will work out what sort of BMI you're in. And so just bear with me 1 second, and I'll just calculate all of that. So that shows a BMI of 21.1. So that's a great BMI, and that's an average. You're in between, so it's a normal BMI. So that's a good thing. You're in the right area there, so that's great. So fitness-wise, we're going to do two fitness exercises. So there'll be one that will test your muscular strength and your muscular fitness, which will be a press up. So you need to, what we'll be doing is I'll show you what I want you to do. So it'll be how many press ups that you can achieve in 1 minute. And then what we'll then do is your cardiovascular fitness. So that will be how long it will take you to row 500 metres on the rower, and then we can work out that and how long, where your fitness is at and things like that, and use those to help with your programme. Okay, brilliant. So we'll get set up and okay then, brilliant.
Cool.
So, okay, so let's just set us up over here. Okay, so I would like you to do 1 minute of full press up. So that would be full press up, so hands in line with your shoulders, and a full press up and up, okay? For 1 minute, and then we'll see how many you can do, and I'm going to count and time alongside that, okay?
Yeah.
Yeah, and everything all right with that? Okay, so ready? Okay, go. rest when you need. Don't feel like you've got to push on through with that. Don't worry, have a rest. That's it, well done, you're doing really well. You've got 20 seconds left. That's it, well done.
Oh.
You're doing really well done. Keep going, that's it, you've got this, you've got 10 seconds.
Okay.
Don't worry if you can't do any more, that's fine. Brilliant, you've got 1 second. Well done, you did really, really well. It is a hard one to keep going for a minute. You don't feel like, you did really, really well with that. Well done, that was great. So the next part of the assessment will be, Right then, Ollie, now we're going to be doing the rowing part. So this will test your cardio fitness. So, rowing machine, have you used one of these before?
Yeah.
Yeah, okay, brilliant. So I'm going to set the resistance a little bit lower than 10, I'm going to set it to 8. So what I'd like you to do is row for the time, and I want you to get to how long it's going to take you to get to 500 metres of rowing. So obviously normal rowing position, to make sure that these are in, your feet are strapped in, holding on, shoulders back, neutral spine so you're upright, and what you want to do is rowing, and ensuring you're pulling all the way back, and it will calculate your meters, and when you're nearly there I will let you do it, okay? Brilliant. Start that off again. So, okay, that's all set, ready for you.
Thank you.
And yeah, that looks great. There's the feet in there. Perfect. And off you go. Okay, brilliant. Well done. You're really well. And this is up to your speed, and however you like, don't feel like you're rushing it, you do it to the speed that you feel comfortable and that you can maintain.
Yeah.
So that's it, you've just gone over 100 metres. If you keep going, that's great, you're doing really well. You're doing really, really well. You're nearly halfway there. Well done, Ollie, you're nearly there. Brilliant, you're 100 metres away now, you're doing really well. Brilliant. Nearly there. That's it, perfect. Thank you very much. That's great. That was 2 minutes and 19 seconds. That was brilliant. That's really good. Thank you. if we come back over here, if you just get yourself, have a drink, a little rest, and we'll come back over here and go back through just the last bit of your consultation. Would you like a drink? Or...
No, I'm okay.
Yeah, brilliant. You did really, really well there. Well done. Move that out of your way. Okay, so how do you feel after that? Was that okay?
Yeah, that was fine.
Yeah, and do you feel that you feel okay? And I personally think I've got no concerns of continuing with this. I think your fitness levels are really good. Yeah, and we can definitely move forward. I've seen no significant worries or anything in those 2 fitness tests that we've done. So that's brilliant, well done.
Yeah.
So let's have a look at your goals. So I want to set your goals and making sure that they're help with you and things like that. So we can definitely get them set and focused around you. So first one would be, so you've got your 10k coming up in March. So I'd like to be able to sort of incorporate, so ensuring that you are running again, whether that be outside or within the gym. So those could be so we can make sure we incorporate some outdoor running and some indoor running as well. So we can incorporate that into maybe your warm-ups, your cool downs, things like that. So you're still running. So we're definitely adding that in. So I'd like to say that we definitely put running into it 2 times a week, and with a goal to be sort of making sure in say about a month's time we're definitely getting on to do 5k, and moving on from that then. Yeah. And also then you've got your tennis competition, so that's something that you'll work on with your partner. It's ensuring as well that you're making sure that you're still being physically active in the gym in the weeks that you are still training with your tennis and things like that. So that's something achievable for you. Also then with your upper body strength, so where would you mainly like to focus on? So upper body wise, would you want to be sort of building chest muscles or arms and things like that?
Yeah, and also my abs.
Okay, so that's great then. So that means that we can then definitely incorporate, so we can add in ab exercises, and you'd like to build, sort of gain more definition to your chest and to your arms. Yeah, brilliant. So that's again, we'll add those into your program, and that's great. So what we will do is we will measure your upper body. So when we do the induction, I'll just take those measurements from you, beginning of your induction, to make sure that we've got those, and then so we can then again every time we review, so it'll be 2 weeks review, we'll measure, see how we're getting on and how much muscle we're building. So we'll be able to do it that way. And so do you think that you will be able to manage to do 3 sessions in the gym a week?
Yes.
Yes, okay then, brilliant. And then we will again review this in 2 weeks, and if you feel that you could probably fit in a little bit more, so I've set it so it'll be an hour 3 times a week. But obviously once we review in 2 weeks time, there might be some scope to sort of add a couple 15 more minutes and things like that, but it's obviously with you and what achievable time you've got from that. So time frame wise, obviously we've got your 10k in March, and the tennis competition is in 2 months time. So what we will do is let's review every 2 weeks, and we can then look at it to be realistically, so we try and so we're on now, we're on November, so when we're looking at Christmas, let's obviously making sure we've got that 5k in the bag and your muscular strength is improving upper body, and then you've got your tennis competition to look forward to. So we've got lots of things to work towards, and good like that. So is there anything else that you would like to ask me? Anything that you want me to run through?
No, I think you covered it all.
So that's all your goals set ready, and the only other thing was just to offer you other suggestions of what you can do around the gym. So we obviously use the gym, so you don't have to do your program card and things like that, but there are also gym classes, so there's a big gym timetable of there's around 8 classes a day, So you can utilise those. It'd be something nice for you to do. There's also a running club every Thursday, which would be great for you to get back into running. Some of the runners are sort of, I think some are beginners. Obviously you're not a beginner, but it'd be great for you to get back into the running side of things, and it's a great way to socialise as well. We also have, obviously, so you like swimming, so we've also got the pool, and we've also got the outdoor pool, which is great for, it's very cold, but cold water swimming is really good for mental health and well-being, and obviously recovery of muscles and things like that. So I would definitely recommend that you have a look into those and have a look at the class timetable and when you can fit things in as well, and maybe perhaps you and your partner can come along to those and do something like that. So yeah, brilliant.
All right.
Okay, then that's great. If there's anything else, obviously just let me know. I'm always about, and we can have a chat and move forward from that.
Okay.
Brilliant, and we'll see you in your induction ready
Bye.
for your programme. Brilliant. Thank you,
Cheers.
take care.
Bye.
Bye.